What is free birth? Today we are talking about everything you need to know about free birth, the pros, cons, things that you should take into consideration, things that the free birth movement is not always super open about, but that you really need to know if it's something that you're considering or looking into. Hi, I'm Rachel Moises from the Mighty Mama Movement. I'm a mother of 8.
And I'm Heather Shelley. I am a family nurse practitioner and a midwife.
Okay, so free birth, it's also called unassisted birth, wild birth. I don't know if there's any other
Has a
terms that
bunch
they're
of different
using
names.
out
Yeah.
there. There's sort of a whole movement that has taken a lot of traction over the last several years. And we are here. We're going to do 3 videos on this so that if it's something you're considering, we strongly recommend you watch all 3 videos because it's information that you really need to know. So kind of explain just quickly what do we mean when we're talking about free birth?
So by free birth, we're talking about no midwife, no doctor, no trained professional at the birth. It's just you and your partner, or maybe your mom or your friend. They might have a little bit of medical training, but nothing official. They're not a labor and delivery nurse. They're not a doctor. They're not a midwife, that sort of thing. It's just somebody who says, oh, I've had some babies. I can help you.
Mm-hmm.
Yeah.
Okay. And I'm assuming this is usually done in the home
Yes.
or somewhere like that.
Typically. Yeah, exactly. Sometimes people will go out into nature. They might rent a cabin or something like that. They might go to the ocean and have a water birth in the ocean, something like that. But yeah, it's that there is no trained maternity professional there.
Mm-hmm.
Right.
Okay, so I want to explain just real quick this. When we say free birth, we're not talking about a home birth. It's an out of hospital birth, but it's not a home birth or a birth center birth. It's different. Okay, so but when we use the term home birth, just because free births mostly happen in the home, it doesn't mean that that's what we are talking about. Free birth is often confused with natural birth or an undisturbed, relaxed birth. So why is that happening?
So a lot of women have had trauma in childbirth, hospital protocols, regulations being shuffled through, and they felt like they were more like a number than an individual. And they want to avoid that trauma. A lot of times they just didn't like what happened at the birth or how they were treated, not the way nature took it, but the way they were treated by other people at their birth. And so they swing to the other end of the pendulum saying, hey, I want a free birth. I want low intervention or no intervention. I want the freedom to do whatever I would like to do without somebody telling me when I can go to the bathroom and if I'm allowed to eat or what I can drink or not drink, or, any of what position I can be in or not be in. They just want that freedom to birth their baby the way they want. And they don't want the trauma. There is a really good saying, and I wish I could remember who said it, so I apologize, it was not me. But the woman that said it, she said, doctors will get off their pedestals when women get off their knees. And that is really important in this, because this free birth will hopefully bring about some change that we can talk about later. But this movement, women are doing it not because they want to be irresponsible, but because they don't want to go through the trauma they went through the first time, whatever that trauma was for them.
So they feel like they're taking charge of their birth.
Right.
And they're taking the control back in their own hands, and they're going to make the decisions, and they're going to do what they want to do and what they feel is best as far as really embracing a fully natural birth without any interventions or interruptions to the natural process.
Yep.
So at the Mighty Mama movement, we are big proponents of natural birth and low interventions, only using interventions when they are medically necessary. So we completely understand this line of thinking, and we teach our mamas about this and encourage them to embrace this type of a birth.
Kind of an undisturbed birth.
Yeah. That does not mean that we actually are proponents of free birth. And so we're going to talk about that. Now, if you're planning a free birth, please keep watching and watch all of our content, because we're not going to really necessarily try to convince you not to do a free birth, but you need to be educated. If you are going to do it, we can't convince you not to, I don't think. Maybe some of the things we teach you might make you question and change your mind, possibly. I don't know. But you have
things to consider.
Yeah, it's just everything to be educated and to know you have a big responsibility if you're going to do this. to know everything and know exactly what the risks and benefits are and all that. So we're going to try to do that in these next few videos to really help you with that. Quick side note, if you have a baby inside of your body that you're going to have to get out of your body, then I've got something I want to share with you. I'm a mama of 8, and my first 3 births were excruciating. I thought unbearable pain was just part of the deal. But everything changed with my 4th baby when Heather, the same midwife and nurse practitioner who's sharing her expertise with us here in these videos, taught me a completely different way to handle labor. I had never heard anything like it, and after I learned all of this, I ended up dilating to 10 centimeters with 0 pain. And after 8 babies, I can tell you, this method works. The problem is most mamas never learn these strategies, and so even if they prefer to turn on an epidural, they worry that they won't be able to. Like my younger self, they believe that giving birth is incredibly painful and that there's no way around it without the drugs. I mean, I had done a ton of research during my first 3 pregnancies, but I never came across this method. I had picked up plenty of tips, tricks, and advice, but not a full-on low-pain birth method that actually works. After that birth, I never even considered getting an epidural again. I didn't need one. That's why Heather and I started teaching this, because birth does not have to feel like torture. If you want a practically pain-free birth, you can actually learn how to do it. It is not luck. We have a 10-step method that you can follow and maybe end up like Mumina, who recently told me that her twin birth was way less painful than her first singleton birth because she used this method with her twins. So if you're curious, make sure you click the link below and save your spot in our free online class, How to Give Birth with Practically No Pain. So before we talk about a few of the risks that you need to be aware of, and we're not fear-mongering here, this is educational content, okay? Let's just touch on a few more reasons why women are drawn to it in addition to avoiding trauma and the hospital protocols and all of that.
Sometimes it's insurance. The insurance will only pay for a hospital birth, and they want a different type of birth. They can't afford a birth with a midwife at home or at a birth center. When I spend a lot of time in Ecuador, and they call them expats, so women, anyone not from Ecuador, typically Canadians, Americans, and Europeans.
Mm-hmm.
And what I found is there's a lot of unassisted birth in the area that I'm in, and the reason is that the hospitals have an 85% C-section rate.
Oh my goodness!
And it's the old-fashioned on your back, back to the 1960s, 1970s kind of birth. Mm-hmm. And they don't want that level of care. And so they do it unassisted because there are midwives in Ecuador, but there's not. There's ancestral parteras, but the training is only 3 months. Some of them have attended thousands of births. It's wonderful. But if you're an expat, you don't typically are accepted by these ancestral midwives. Mm-hmm. And so there just isn't a lot of choice for them. So their choice is, I can go to the hospital and fight like crazy to not have a C-section, or I can do it by myself with my husband or whomever I can find. Mm-hmm. And so that's why some people do it in the United States and Canada, is they may live very far. They may live 3 or 4 hours from the hospital. They don't want to get an induction. And so they're like, okay, I'm just going to fly by the seat of my pants because there aren't a whole lot of choices for me. Mm-hmm. In some areas, there are not any home birth providers or out of hospital birth centers. And so once again, their choice is hospital or not. And mm-hmm. the hospital is so scary and glooming to them that they will choose the unassisted birth.
I think another thing that can influence people's choice here is if they've given birth before, right, and there was no complications, no problems, and so they kind of have that confidence. I know how to give birth. I trust my body knows what to do, which is absolutely true. And right. You should trust your body, and your body does know what to do. But we're going to touch on a few of the risks and not go into too much detail here because we do have another video where we talk all about some of the dangers. And again, this is just educational. You need to know this if you're considering a free birth. Okay, so for this video, we're not going to dive into all of the risks like I just said, but what are some of the higher level concerns of doing a free birth versus having a midwife or doctor attend your birth?
So the biggest thing is it's the what if something goes wrong. And I will say, many times the hospital causes a lot of these problems. They
Mm-hmm.
do Pitocin that causes fetal distress, exhaustion, epidurals, crash blood pressure. So there are a lot of things that the hospitals do that cause the problem. So they think, well, what are my chances of having these problems because I'm not getting an epidural and I'm not doing Pitocin and I have nobody bugging me and telling me to starve
Yeah.
and all of these things. So they're thinking, my risks have gone down. And yes, your risks have gone down, but birth can go wrong. And when it goes wrong very quickly. And it's usually quite catastrophic. The number one reason for women dying in childbirth in the world is hemorrhaging. There is something called a trickle bleed, and that one can take time, but it's deceptive because you think, oh, it's just a little bit of blood, it's just a little bit of blood, but it's just a little bit of blood over a decent amount of hours.
Yeah.
But most hemorrhages happen hard and fast and quick and have to be controlled very, very quickly. For myself, I have had a very bad hemorrhage where I lost half my blood volume in 45 minutes and was passing out. Ambulance was called. My midwife, I don't think she was very thrilled at the time, and I know my husband was very afraid. And so it can happen very hard, very, very fast.
Mm-hmm.
It can happen with miscarriages. It can happen with birth. It can happen hours after birth, even. And that one's not very common, but when it happens fast. And so a baby not breathing, we only have minutes at best to get that baby breathing. Any of these complications, minutes, most things after 10 minutes, it's game over. That's how fast it is.
And I want to point out that it happens fast, but also as a layperson, as a regular non-professional, it also takes longer to recognize that this is serious. I've had a couple of complications with some of my births. I didn't even know what was going on or what was happening until it was already resolved, and the midwife, which is Heather, she's my midwife, had taken care of it, and then she explained what had happened. But I hadn't even realized yet that there had been a problem. I didn't even know until she told me.
That is a really good point because my hemorrhaging was with a miscarriage. It wasn't with childbirth. And my midwife was on her way to me. And when I was passing out, she got to me right before I passed out. And so I had done attended births for 10 years. I had training under my belt. And at 30 minutes, I was like, I look back and I'm like, I was totally hemorrhaging. What was my problem? But when it's happening to you, you don't see it. Mm-hmm. And so I look back and I was hemorrhaging hardcore. And when she got to me, I was sitting on the toilet, passing out, starting to lose consciousness. And then I lost consciousness for about a good 30, 60 seconds. When I woke up, my husband was on the phone. And that's the thing. You don't realize it's happening. You think you will, but you don't.
Right. And if you already don't have professional help really close by or on the way, and then you delay a little bit, and then by the time they get there, it can just be
it's a big snowball.
Late.
Yeah.
Which, again, I'm going to say this so many times, we're not really trying to scare you. We just want to be really real about this.
Right.
So that you can make the decision that you truly want to make, a truly educated decision.
Exactly.
And we want you to understand that you do not have to choose a hospital birth with excessive interventions and policies and potential trauma and all of that, or a free birth. If you're trying to decide what to do, those aren't your only two options. There are other options to have a low intervention, low risk for complications birth that's the way you want it to be, and that's in the environment and the setting that you want it to be, and that still has the safety precautions for the what ifs and potential emergency. That does happen in a relatively small percentage of home births, but they do happen. So we're going to do another video we hope you'll watch that goes a lot deeper into the risks and dangers of free birth or unassisted birth or wild birth. We're going to dive into some of the controversy behind the movement. And this is pretty intense stuff that, again, if you're considering it, I really hope you will watch this and learn all about it.
And some of the middle grounds that you were starting to mention are home birth with a trained midwife. There are about less than 10 doctors in the country that do home births, but there are a few. Birth centers, freestanding birth center, not a birth center associated with a hospital, but that freestanding, because they're going to have more relaxed guidelines on eating and drinking and water birth and those sort of things. And so those are good middle grounds. For an area that doesn't have those middle grounds, the big thing, and you think, okay, I can do the hospital or I can do a free birth, and you don't feel comfortable with a free birth, or maybe your partner doesn't feel comfortable, your spouse, whatever. That's where you can pre-negotiate things. And I've had many, when I was a doula clients that would say, hey, I have type 1 diabetes, or I know I have these risk factors, and I know I'm going to be just plowed over with interventions. So they went in beforehand. They found a doctor who would truly negotiate with them, usually through other doulas. And they would say, okay, this is what I want, and let's negotiate it. Because the time to negotiate is not in labor. The time to negotiate is beforehand. So if you want that vaginal birth after cesarean, if you have that type 1 diabetes or gestational diabetes, negotiate these things beforehand and stand your ground. Get the hospital patient care advocate involved if you have to. Doctor with my second baby was great. He said to the nurse when I came in, he said, give her whatever she needs. Don't make her cry. And he said, if there's something you can't give her because of hospital policy, let's figure it out. And because I had discussed that with him and said, listen, I don't want a repeat of my first birth, not even close to that. And every single appointment I negotiated with him to find out what we could do and why, if he couldn't do something, was it because of him or was it because of the hospital? And that's where the patient advocate can come in to say, let's get hospital policy changed. And that's the only way it's really going to get changed, is by patients coming forward and saying, if you want our business, we want water birth, you need to change it. And you need to figure out how to do it, because other hospitals across the country are, and they're doing it home births and birth centers all the time, and it's turning out just fine. Or I don't want XYZ, let's get this changed. And the women have the power to change that.
It's really important that you pointed that out, because a lot of women who are choosing these free births, it's because due to high risks, they should be in the hospital and they don't have that option for a home birth. But then they're going to the extreme of the free birth, knowing that they have high risks.
Exactly.
It's a lot riskier when you're high risk.
Exactly.
There's a reason that high risk pregnancies are not always accepted in a midwife practice or an out of hospital birth. And so it doesn't have to be hospital birth with all of the things that you don't like about hospital births or free birth. It's not as easy to get what you want, but I think what everyone cares about is their own safety and the safety of their baby above all
Exactly.
else, above having a great birth experience, right?
Right. And that's the thing too that hospitals and just providers in general need to realize, is your goal isn't a healthy mom and a healthy, or an alive mom and a alive baby, right? That should be the bottom of the barrel.
That's pretty basic.
Right. Pretty basic expectation. We want a live mom and live baby, okay, with no damage. And our goal should be a happy mom, a happy baby, no postpartum depression, no PTSD. Like it's the whole birth experience, not just, well, you walked out of here alive. Like that should be a given.
We did our job.
Right. So if we would have a lot less postpartum depression, a lot higher breastfeeding rates, if the goal was up here as a healthy mom, healthy baby, mentally, physically, spiritually, rather than just, well, you made it out alive. You know what I mean? So big difference there.
And we talk about a lot that changes one woman at a time, with one doctor at a time, advocating and standing your ground. But we realize not everyone watching this wants to even deal with that or is going to deal with that. So whatever you are going to choose, watch our next video and learn more that you need to know about free birth.